Because some people, one small people, they say they have severe acne. Now, even severe acne. So you're talking about your nodules, your cysts. Sister. Hello guys, welcome back to my channel. It's your favorite esthetician again. If you are new here, welcome. My name is Amaka, and on this channel I wear many hats. 1 minute I'm your favorite esthetician, the next I'm your favorite CEO, another time I'm a Canadian vlogger. See, anyhow you see me, take it like that. Today, Sha, I am coming as your favorite esthetician, and I will be answering some questions on skincare that were, let's say, made on Instagram. Not just Instagram, Sha, here and there, but Instagram primarily. So let's not make plenty small talks. Let's just go, straight into the questions. I want to try and make like 2 videos or 3 answering these questions because they are a lot. Now the first question is, I always use BP, that's benzoyl peroxide. I always use benzoyl peroxide wash before using my tretinoin. Can I continue? Yes, you can. And in case you're wondering why this question was in the first place, a lot of specialists have said, not just specialists have said, I think I've made a video on that. I think my video on ingredients that you should not mix, that you should not apply benzoyl peroxide and tretinoin at the same time together because they cancel out each other. I think it's the benzoyl peroxide that makes the tretinoin ineffective. You don't use them together. Now, this does not apply to all retinoids because tretinoin is a type of retinoid. I also have a video on retinoids and different types of retinoids. There are some retinoids that are stable when paired with benzoyl peroxide, like adapalene, different gel. Yes, so now this applies when you are using both of them in a leave-on product. So you're using a benzoyl peroxide gel and a tretinoin gel. But if you're using the benzoyl peroxide wash, because it's not left on your face, you absolutely can use a tretinoin product after your benzoyl peroxide wash. So far as your skin can take it, because both ingredients could be sensitizing, I think you are perfectly fine. Then the next question, I have never used organics in my life, organic product in my life. So I tried one soap and it gave me black stretch marks on what? It gave her black stretch marks on her hand. What can I use for it? Ha! These organic people say they are tired. But most times when you get stretch marks as a result of using an organic product, it's usually because they have put steroids in them that causes that stretch marks. But anyway, what I would advise you, let me just go straight to the point. Stop using what you're using. Obviously, I believe you already know that. So stop that. Then start using tretinoin on the affected areas and creams with Centella asiatica, so they could help. Do you understand? They could help, especially if addressed immediately you see the stretch marks. When the stretch marks are still fresh, they could help. But honestly, in a lot of cases, stretch marks never really go away. But if addressed, promptly, could fade significantly. Sorry about your experience, honestly speaking. This organic people say the matter don't tire everybody, in fact. Anyway, on that question, is fragrance in vitamin C advisable, e.g. advanced clinicals? Well, this question got as a B. Is fragrance in vitamin C advisable? I would say the same thing applies to the same worry you have with fragrance in every other type of product. Still, English. The same worry still applies. Do you understand? The worry being that some people may be sensitive to it. It can cause allergic reaction. All those things. The same thing you experience. The same thing you experience if it's in a product with vitamin C. Do you understand? So if normally you have sensitive skin or you're worried about fragrance, generally, then look for vitamin C products that don't have fragrance. And if you're okay with it, then you can use a vitamin C product that has fragrance product. Except you want to argue that vitamin C in itself, because it has a low pH, could be sensitizing, and then the fragrance component can make it worse. That can be an argument. Do you understand? But if you ask me, I'll just say, if you have a problem with fragrance, then stick with products that vitamin C products that don't have fragrance. Yeah, I hope I did not confuse you with that. If I confuse you, it's alright, Sha. Let me know and I'll explain better. So, can pregnant women use snail mucin? To the best of my knowledge, yes, because snail mucin is usually added to products for hydration, or snail filtrate for hydration, soothing effects, encouraging wound healing. So it can be used by pregnant women. I have a video on, the best ingredients. Let's say the best. No, no. I have a video on ingredients that pregnant women. No, pregnancy safe skincare ingredients and ingredients that pregnant women should avoid. My face is rough. My face is rough and have been on medication since late March. I shopped my products from you. I don't know what medication means. Do you mean like systemic medication, like what you medicine that you swallow, or you mean medication as to skincare products? This question is not really clear. But if you are referring to medications that were prescribed by a doctor, then go back to the doctor and explain. If you're talking about what you're calling medication are actually skincare products, I need to know, what your concerns are and what products that you have been using. Because it's one thing to be using skincare products, and it's one thing to be using the right product for you and that skin concern. You'll be shocked how many people have been consistently using rubbish. Not rubbish per se, but you get me. It's like you having malaria and you're consistently taking cough syrup. Will it work? Do you understand? Can I use CeraVe moisturizing cream on my face, and which facial cream is best for oily skin? You absolutely can. And the thing about face and body products, you can use most body products on your face, but there's a but. Do you understand? Now, most times face creams are, manufactured slightly differently. Maybe there will be more actives, maybe it will not be as thick and as rich as the body, because the face skin and the body skin are different. Usually the body skin is thicker, less sensitive, and not as oily as the face. The face skin is usually more sensitive, thinner, and so there's usually more actives in the face cream. The emollients put, or rather the oils used, are not as thick. Do you get? So you should have that in mind. So when using a body cream on your face and you have oily skin, and you're using a really thick and rich body cream on your face, you may start experiencing clogged pores and breakouts. Do you understand? So these are things you should bear in mind. But to a large extent, you can actually try your body cream on your face and see. And also, there are some body creams with actives that may be too sensitizing for the face, but maybe okay for the body. Like all those body creams, you see them with 12% glycolic acid. Now, because your body skin is thick, it may be able to withstand it, but on your face, it may be really sensitizing. I have a feeling that I've gone on a full-blown rant, but I'm just trying to say that whether or not a body cream can be used on the face will be determinant on the actual formulation of that body cream and your skin. But there are some body creams that are somewhere in between. Like, a lot of people can use them on both face and body. CeraVe moisturizing cream is one of those in between products. Treatment for dark eyes. Now, treatment for dark eyes. See, I don't like addressing treatment for dark eyes, and trust me, I'm sure I'm sitting on every video, every ask me anything. Dark eye. The problem is one of all those very confusing. No, I'm gonna say it's confusing, complicated. Not very straightforward. Not very straightforward, because what may be appearing as dark eyes may not be hyperpigmentation. Do you get? Like, there are different factors that can make your under eyes appear darker. The first one is shadow. Now, because of the way your face is structured, here is underneath and your forehead is protruding. A lot of time with bad lighting, the shadow from here can be cast underneath your eye, and it may make you appear like you have dark under eyes, especially when the light is coming from above. If you place the light in front of you, you may see that it doesn't appear as dark. So that could be happening, just poor lighting or shadow. And that thing again could be loss of fat, or the way your eyes are structured. So if you have a deeper tear through, like this side of your eyes, if it's deep, it would look darker. Also, with age, loss of fat and elasticity, it also gets deeper, and then it will look darker. And then there's pigmentation, like hyperpigmentation, excess melanin around that region. It could be as a result of genes. Maybe you guys in your family just have darker eyes, just have more active melanocytes, or just produce more melanin around that region, and it could be as a result of sensitivity. You use products that sensitize your eyes and then leads to an inflammation and then post-inflammatory hyperpigmentation around your eyes. So how it's going to be addressed will be dependent on what exactly is causing it. Now, if it's a case of structure, like deeper tear through, you would want to see, products will not do much. Do you understand? It will not give you fat there. You will literally have to go for a procedure. It could be fillers, it could be, call it fat transfer. See, that is not my specialty. Please, estheticians, medical estheticians, or all those people in aesthetic clinic, please explain what the procedures are. But if it is hyperpigmentation, then you are looking for products that actually can address excess production of melanin. And the thing is, because of how sensitive the eye region is and how thin it is, you want to, this is one of the areas that I see eye creams as being essential, because yes, you can use like normal face moisturizers that are brightening around that area, but it's safer if you get eye products that have brightening ingredients, because what that means is that they have taken more attention that these products will be used around the eye, and usually it is less sensitizing. Because if you use a general skin brightener around your eyes and get sensitivity, then you go back to the initial problem, which is inflammation and post-inflammatory hyperpigmentation around your eyes. And one very quick test you can do, another reason, if I get to the test, another thing that you may be experiencing is because the skin around the eye is so thin, then the underlying structures, your blood vessels and your muscles, are now more prominent, and it then makes that area look discolored. So one very quick test that you can do to know which you are dealing with, I saw this on YouTube, I can't remember, I heard one of these doctors talked about it, and it's when you stretch the eye stretch test. So you stretch out your eyes, and if you stretch it out and you see that you can't see the pigment anymore, it's most likely a structural problem. So it's because your eyes are just appearing dark, but they are not actually dark. Now, if you stretch out your eyes and you can still see the pigment, then most likely it's a pigment problem. And if you stretch out your eyes and the pigment seems to be worse, it's most likely a texture problem. The skin around the eyes are thin, and so the underlying structures are now more obvious. If your issue is pigment, yes, get products that are depigmenting. If your issue is thinness of the eye, now products that have things like tretinoin or rather retinol would be advisable, because they thicken the skin. And if your own is structure, then you guys do feel like all those things, but most importantly, go and see a specialist so they can actually give you the right diagnosis of the one that is worrying you. Sorry, that was long, but that was essential. So yeah, where are we? Panoxyl and Replenix BP wash, which is better? Honestly, both are fine. Just depend on personal preference. Try both of them. Which one do you prefer? But I think, in my opinion, they'll both give you the result that you need. Then what? But I've not heard some specialists say that their clients have observed faster results when using Replenix. So I don't know. Me, I have not observed it from my own clients. Then what can I use for severe acne? It depends on what you're calling severe. If it's the severe acne that we all know, I don't know about what you're calling severe, because some people, small people, they say they have severe acne. Now, if it's severe acne, so you're talking about your nodules, your cysts, all those things that are inside your skin. Sister, go and see a dermatologist, because a lot of the times they will have to give you systemic medication, drug that you throw inside your mouth to fight that thing from within. Now, what those medications do is that from within they significantly control sebum production, oil production. Now, the reason why you have to go to the dermatologist as soon as possible is those types of severe acne, your cysts and your nodules, they leave scars. I'm not talking about black spots, I'm talking about scars. Those ones that you cannot remove with medication. No. You guys go back again, go do procedure. You have to go back and do some procedure, maybe microneedling and all those things. That's not my specialty. Do you get, to actually make them appear better? But if you're referring to mild moderate acne, so I'm referring to your comedones, blackhead, whitehead, papules, pustules, even if it's inflamed pustules, then you can use the regular acne treatment, your benzoyl peroxide, your salicylic acid, your AHAs, your azelaic acid, your tretinoin. All these ingredients are not, they're not more like, they're not common knowledge, like people know them. It's all about how to use them to suit you. So that is why no matter how much all this information is now in the public, sometimes you need somebody to actually guide you. What products can I use to manage hormonal acne? The truth is, honestly, pretty much the same thing you use for regular acne. There's no special thing for hormonal acne, except you are not prescribed birth control. First of all acne cases, to an extent, has some hormonal undertone because they usually start with excess production of sebum oil, which is regulated or influenced largely by the androgen hormones. So you understand how almost every type of acne has a hormonal undertone to it. Now, the thing about hormonal acne is that we believe that there has been now excess maybe production of the androgen hormones, but sometimes you can have hormonal acne not because there's an excess production or abnormal production of androgens, but because your receptors are now more sensitive. I bless I don't deviate though, but to cut the long story short, use normal products and please go and see a doctor for them to really determine that actually there's a hormonal imbalance, and then they can prescribe birth control for you. Usually birth controls that have progesterone and estrogen, the combination. Yes. Can sensitive and acne prone have BP wash and BP toner in her routine but use them differently? Absolutely. I mean, you just said it. You can have BP wash and BP toner. You can have BP wash and BHA toner, that's salicylic acid toner, in your routine and use them differently. Oh my god. Hello. Yes, why does glycolic toner make my skin itch? Okay, so I don't know if your skin is itching or if it's itching like scratching you, then you may want to check the formula. But I think what you may mean is, why do you get a stinging sensation? And that is because of the pH. Glycolic acid is an acid and it should be formulated with a lower pH for it to penetrate the skin and actually work. The pH of the normal skin is somewhere between 4.5 to 5.5, or you want to stretch it 6. Now, for glycolic acid to be effective, is usually formulated at a pH of less than 4. So way less than the actual pH of your skin. And the more acidic something is, the more stinging of the sensation you feel. Do you understand? And the more alkaline, the higher the pH is, the drier your skin feels. And that's why sometimes when you use black soap, your skin feels really dry because it's really alkaline. And when you use things, acids, your skin stings because it is acidic. So that is why you get that stinging effect. But usually it just happens for few seconds and it stops. You see, if it exceeds that few seconds, 1 hour down the line, you are still stinging. It's not a pH problem now. Is either maybe it could be that your skin barrier is impaired and so it doesn't bounce back, because your skin has a particular pH, and even if it's disrupted to aid penetration of an ingredient, it should bounce back immediately. But if you see the sting after 1 hour, check out. Either it's your skin barrier problem, or it is the formulation problem. One of them. So yeah, reapplying sunscreen is so uncomfortable. I feel like washing my face before. Yes, I understand, and I understand because it's hard to understand when you don't stay in a country like Nigeria that is really humid. Abroad, before you say Jacob, say you're applying again. 2 hours? No, I can do 1 hour safe. Do you understand? But it's not the same thing, and the truth is, the fact remains that you need to reapply your sunscreen to get the optimal benefits. But don't judge yourself too harshly. If for some reason you feel that the weather is very hot and very sticky and you absolutely cannot apply your sunscreen, and even if you apply your sunscreen now you just sweat everything away, then it's okay. Just try and practice sun avoidance till you get in the best of your ability. I will not stay here and just say you, even if you are sweating right under the sun, the fact that it's pouring on your body, be applying. That's not practical, do you get? But I will still state the fact that you will not get the maximum protection if you don't reapply your sunscreen. But at the same time, don't judge yourself too harshly if you can't. Yeah, I think I'll stop here so I don't make this video so long. And see you guys in my next question and answer. This will be weekly. Usually I don't like saying things I would do so that I won't feel bad when I don't do them, but I will say this one to hold myself accountable. So anyway, thank you guys so much for watching. Don't forget to like, share, and subscribe. And if you want to know, if it's okay if you're all about skin, that's fine. If you're all and only about skincare, it's fine. But if you want to know other aspects of my life and what I get to do on days I'm not feeling the role of an esthetician, then please check out my vlogs on life as a CEO or the diary of a CEO and my Canadian living vlogs. Thank you guys so much for watching, and see you guys in my next video. Bye.